Hello, everyone, and welcome to EllieMD's live educational series. I am Honey Sagari, founder and CEO here at EllieMD, and we are delighted to have you guys back for another wonderful educational series. At EllieMD, community and education are at the heart of everything we do. We don't want to just offer access to cutting edge therapies. We want you to understand them, feel confident with them, and surround yourself with a community of people on the same journey towards better health and longevity. Tonight is a big one. We have officially launched Epitalon. So tonight we're doing a full deep dive. What is Epitalon? How does it work at a cellular level? And the full range of benefits that have made it one of the most talked about peptides in the longevity space, sleep as well. This is the conversation our community has been waiting for a long time. And we want you to leave tonight with a real understanding of what this therapy can do and whether it might be right for you. To take us through every layer of it, we're thrilled to welcome back Dr. Jason Pencek. Dr. Pencek is a board-certified nurse practitioner and chiropractor who blends traditional medicine with integrative and longevity-focused care. He started in nursing, expanded into chiropractic medicine, and has spent over a decade working at the intersection of peptide therapy, hormone optimization, and metabolic health. His whole approach is rooted in treating the full person, not just the symptoms. Dr. Pencek, we're glad to have you here. How are you doing tonight?
I'm wonderful today. Thank you for having me again. I love it.
Oh, well, thank you. Thank you for educating our community and just being wonderful to all of us and walking us through Epitalon tonight. I'm excited to have this conversation with everyone. So, is there anything you want to start with? Anything on your heart that you want to get off?
Um, I really love LAMD.
Oh, that's great. Okay, we
Is that
do
what,
too.
is
Glad
that,
we're
is
on
that
the
what we're
same
supposed to say?
page.
Okay. That's on my heart. No, I mean, I love Epitalon. Epitalon, people call it a couple different names, pronounce it differently, tomato. But it's a wonderful peptide that I do love in practice quite a bit. I've used on myself plenty of times. It's just such a wonderful peptide. I do love them all peptides. Your Epitalon is not one that you're probably going to use every single day, but it is one that definitely should be used as part of your protocol. Everyone should consider using um, Epitalon and find a way to have it. So, yeah, I'm super excited to talk about it. It's a great option.
I'm sorry. I also have my kids reminding me that there's no Wi-Fi. Aiden, there's a lot of people on the call, so I'm doing an educational story.
It's so cute.
I know.
Kiddos.
It's 7 o'clock here, so I understand. Okay, Dr. Pensek, let's
Yes.
start. Thank you all for understanding. For anyone who's a mom, please. So let's start from the very beginning. Can you walk our community? What is Epitalon and what does
Yeah.
it do? If they haven't heard what Epitalon is before,
Yeah. Of
can you
course.
just walk us through the mechanism of action, what exactly this peptide is, and how it works on the body?
Yes. So Epitalon's simple. It's four amino acids, very short. Synthetic version of what's called epithalamin, which is naturally made, and it's produced by the brain's pineal gland. So we naturally make this thing, and we made a synthetic version. This is kind of like how BPC was decapentapeptide. So we naturally made it. They said, "Hey, this does something really cool. What else can we use with it?" And this guy, Covinson. He died a few years ago, but he was a Russian, I guess, scientist who was studying. He studied a few different peptides, a few of the bioregulators. So Epitalon is considered a bioregulator, and so he was studying it and thought it was really interesting in how it acts like a master switch in the body and can work on the pineal gland, which is a really big part of our, brain. Not, I guess, big in how the size of it, but what it does. It works on controlling circadian rhythm and morning wake cycles, as well as helping improve things such as inflammation and telomere sensitivity. We'll talk about some of these things later. So he developed it, he found it, made a synthetic version of it, and the whole point was to make a signaling peptide that causes our body to continue aging gracefully and to slow down that aging process. Unfortunately, Cavinson died a few years ago, but I actually had a patient when I first started doing this who I guess Cavinson's Vladimir's email was online somewhere. So he just emailed Vladimir, "Hey, Vladimir, I got this Epitalon. Do you mind if I ask some questions?" And he was answering my patient's questions through email, which I thought was really cool because this is a, really interesting space. And if I could have emailed him and I would have, I wish I did back then, I would have had a few questions. I want to know the research. I want to understand how you did this, why you did this. He actually had some interesting studies on Epitalon. One of the things we talk about is also telomeres and longevity. And Epitalon is one of these peptides they found, I believe, is in fruit flies, if I'm correct. The In 10%, the oldest living fruit flies, they live 10% longer. So the idea is there's some longevity associated with taking Epitalon. And he found actually did some human studies and showed actually for heart disease, it worked really well to help reduce the risk of cardiovascular disease as you age, especially in the older population. So not only does it do circadian rhythm and work on sleep, it also works on helping improve some longevity things we look at. So he found that it could help restore pineal function, which is an important thing as we age. We believe the pineal gland actually gets calcified as we get older. So using something like the Epitalon could really be useful to helping improve, again, how sleep is as you age. And a lot of people out there, if you're younger, in your 20s and 30s, maybe you don't have poor sleep yet, but as you get older, sleep tends to degrade. And you get in your 50s, 60s, 70s, 80s, and sleep just isn't as good. You don't wake up, you don't feel quality sleep, you're just exhausted, even with using hormones. As now we're adding to clients here with EllieMD, sometimes it's not enough. So Epitalon is one of these really cool peptides. It actually has a few things it works on. We use it a lot for the sleep side, but also there's that whole longevity side that's been used for as well for quite some time.
Okay. So you mentioned bioregulator. If
Yeah.
you can walk us through what a bioregulator is, I did see a question that came in. So touch on that. And if you could also walk us through what telomeres are and what Epitalon does with telomeres and telomerase, the telomerase enzyme.
Yeah. So we'll go through telomeres first. That's the most important thing. Telomeres are basically they're the little shoe caps that go on the end of when a cell divides. They have part of the DNA kind of gets cut off. That's what happens when a cell divides. And telomeres are these basically plastic pieces at the end of the shoelace that protect the shoelace from getting shorter and shorter and shorter. Eventually, when the shoelaces get shorter and shorter, you keep cutting off the end of the shoelace, you keep putting a new cap on it. You eventually have no more shoelace, and you eventually cannot have the cells divide. So basically, at some point, the cells stop dividing. That is what happens, and that's where telomeres sit in. The whole idea is that you can cap these telomeres, and if you can find a way to elongate them, telomerase is actually a way to elongate these. And what we're trying to do is lengthen these telomeres because these telomeres eventually lead to the cell basically death. After this, the cell, when the telomere gets short enough, it's leaving unprotected DNA. So each time a cell divides, it has to copy the DNA. And when this DNA is now unprotected, it stops dividing. This whole thing just kind of stops. And then in these cells stop dividing, what happens is we get what's called the zombie cells, senolytic cells. We believe that these senolytic cells are the reasons we have a lot of the aging process that occurs, right? Alzheimer's, um, lung disease, cancer, heart disease. These are related to what now is believed to be senolytic cells or zombie cells. These are cells that have stop functioning as they should and send out aberrant signals, random signals that just cause inflammation on the body, and they just signal the body to do different things, and they shouldn't be doing it. So getting rid of zombie cells or senolytic cells is really important. And if your telomeres keep shortening, eventually these cells turn into zombie cells. That's just what's left. They can't divide anymore and they sit around and do nothing. So what we want to do is protect the cells in our bodies from getting to the point they can no longer divide and continue to make the new cells that go down the line. And this is where you can have Epitalon fit in. So Epitalon actually works on this ability to continue this division by working on telomerase. So telomerase is actually how we lengthen these telomeres, these we call them base pairs of the DNA. Now it's really interesting. I used to post a lot in Reddit as open-minded Chicago doc, and I was prolific in responding back to people. And I remember reading someone a while ago, you can actually study and you can research and get your base pairs measured. So this is happening now. There are some longevity clocks look at this. So if you've ever done any kind of um, testing to see your biological age versus your actual, like, real age, so biological, sorry, versus, what's your body, your cell age. A lot of these tests will actually look at telomeres, look at the length of this. They can check the base pairs and how short these telomeres have gotten as you age. So I remember reading a couple of people that were actually on Reddit. And again, this is Reddit, so questionable as it is, it's kind of a cesspool in general of what are out there and who's out there. And this was must have been 7 years ago, 6 years ago. And someone had measured, a couple people had measured their base pairs and did before and afters. And they found that they had lengthened their telomeres. Now, it wasn't long. It was like I think 5 to 10% longer. Not maybe 5%. It was pretty short. It wasn't a huge change over the course of using two rounds of Epitalon, but they did see an improvement. So this was really cool because normally you see these base pairs keep getting shorter and shorter and shorter. Again, as these cells divide, they get shorter and shorter base pairs. These telomeres shorten. And this was the first person showing, hey, I actually have data showing my telomeres lengthened. And it wasn't just one person, several people came back and said, actually, I have the same thing. So it was very interesting for me to see that in practice because at the time I was not measuring telomeres. I still don't unless you're running some of these, again, these testing for the aging process. We don't do a lot of that right now, but that is one of the things they look at is knowing how long your telomeres are and how many base pairs are left. So lengthening these things is really important, and Epitalon can work on this because it works on telomerase, which again is the way to rebuild or to lengthen the telomeres. It's like the maintenance crew that comes in and says, okay, we're going to make these a little bit longer. Normally it just shortens, but if you can upregulate telomerase, you can actually improve how long these telomeres are. So again, you also asked about bioregulators. Bioregulators are just basically short peptides. So about 2 to 4 amino acids. Just so you know, some of the different peptides we use in practice, things like semaglutide, tirzepatide, tesamorelin, these things are in the 30 amino acid length and maybe up to 40 or 41, 42. So we work with bigger peptides. Remember, peptides are just a short chain of amino acids put together. And you can have really small peptides, things like KPV, 3 amino acids, GHKCU, one of our favorites, 3 amino acids, um, glutathione, 3 amino acids. Not every bioregulator, every peptide glutathione is considered a bioregulator, but in general, bioregulators are just very, very, very short. These short peptides are what we typically call bioregulators, and they're signaling molecules that help restore normal tissue function. A lot of the bioregulators will come as oral products. Epitalon is one of the few ones that doesn't. There's other ones I use in practice, such as Panilion, which also improves sleep. That's another bioregulator I do injections with. There are some other ones that aren't required to be injectable, and some people don't inject them. It just depends what the bioregulators are. There's lots of different bioregulators out there, and Cavinson was like one of the big people studying these things and saying, hey, this does this, this does this. And there's a whole bunch. If you go down the rabbit hole of bioregulators, some people come back and say they work wonderful, and some people come back and say bioregulators didn't make a difference. I do notice this bioregulator specifically does seem to make a difference in patients and how they feel. And there is some data, again, small studies that at least Cavinson did that did show some improvement in the patients that used it. And these were, human studies, again, small. And a lot of people discount the data Cavinson did because they were small and it was Russian. So we don't really trust Russia, especially back when he was doing some of this work. We were hesitant to believe it, but it does exist, and there is some really good stuff showing that Epitalon or Epitalon can improve even the lengthening the length of your life. I believe the two studies that I'm thinking of right now, off the top of my head, were heart disease studies, and they looked at people in their 70s. I want to say in their late 70s and early 70s. They did two different studies, and they showed that I believe it was the 20% of people that took the Epitalon, they lived about 20% longer. They were less they were risk averse from having any kind of cardiovascular, heart disease, stroke happen. So these people lived longer than everyone else, people that had taken this. And again, the elderly, the older the patient, the better it was. In fact, the second study they did was even in older patients, and the older patients had even better outcomes. They had even bigger reductions of heart disease at that age. So There is something to this Epitalon, right? Again, small studies. We don't have a lot of randomized controlled trials. We don't really have anything like that in Epitalon, unfortunately. Thankfully, this is one of the ones the PCAC voted on to bring to have and be like, yes, this is great. We should all be, it should be okay. It should be safe to use. So I'm really excited that a lot of people will start getting access to this. A lot of people weren't using this as much as they could. I do see a lot of benefit in Epitalon, even from the sleep side, not even longevity side. But I have seen, honey, I've seen some crazy things. I gave it to my mom a long time ago, and she randomly had, again, I never ask her, my mom what symptoms she has. I just start giving peptides to her randomly and just see what happens. Because it's a fun game to play. Let's see how this helps. And for this one specifically, she had some restless leg syndrome. And I can't say this fixes every patient's restless leg syndrome, but for her, it did. She said, when I took this stuff, my restless leg syndrome went away. Now, she had it gone for about 3 to 4 months after that. And she's like, it didn't come back. It was great. And then it slowly started to creep back. So, again, it did come back. It wasn't a permanent fix, but she had no idea. And I had no idea. And I've seen even things like I've had patients start their cycle again when they're in their 50s, early 50s, when their cycle had gone away for maybe 2 years, all of a sudden they get their cycle back. I've seen patients get their hair go from gray to colored. Again, this is not happening to everyone. These are individual cases. I don't know what happens with Epitalon. Not everyone has some of this miraculous improvement. And even the person went from gray to color didn't have their whole hair go back to color, but they did have noticed some of their hair start having color in it again. So Epitalon's just a really interesting peptide that I'm a really, really big fan of. So I really do like that we have access to this now, that more people can start getting use for Epitalon. So.
I'm reading some of the comments. They're like, nobody wants their cycle back. Heck no.
Ladies, I'm so sorry. It's not going to
That
happen to
might not
everyone.
be the seller here.
Dude, this
No.
it was just like as a one. I think it was like one patient again. So I've had lots of patients do it, but this is just one. She was like 51 or 52. She was close, maybe. And that's the thing. So women, I want to tell you, having a cycle longer is better. The women that have cycles, the longer you have a cycle and keep cycling, the less risk of heart disease you have as you age. That's a really good thing. That's because estrogen is really good for us. Talked about this before. We can go to hormones for 3 seconds here and say, hey, estrogen is very heart protective. So having a cycle longer means you have better estrogen production as you age. So these women that have longer cycles compared to 50 to 45-year-old going through a cycle and losing your estrogen, the women that are older have less risk of heart disease. So this woman getting her cycle back may not have been great for her. She probably wasn't very happy, and I can tell you she wasn't happy with me. That did indicate to me she's creating more estrogen, which is again heart protective, brain protective, and does a really good job with collagen production. All these things we use estrogen for. So there's a reason why we like estrogen, but we don't want to bring your cycles back. Yeah, I agree. No one, no one wants that at
Well,
in their 50s.
yeah, someone said I don't mind having another baby, so maybe it just depends who you're asking. Um,
Okay.
so you mentioned the PCAC, and we were there
Mhm.
2 weeks ago, and it was
Right.
so interesting listening to all the studies and the benefits. And afterwards, I had the opportunity to speak to a lot of these researchers and physicians, and they were blown away. I mean, what they mostly talked about is how it resets the circadian rhythm, and
Hmm.
how it helps people who suffer from, narcolepsy and they can't sleep very well, how much Epitalon helps with that. I know the circadian rhythm gets talked about a lot, but most people think it's just their sleep schedule. Can you explain what the circadian system is actually doing in the body beyond just when we sleep, and why disrupting it has such a wide ranging health consequences? And then follow up, just in case my kids come back, just follow up with what Epitalon does specifically for the circadian rhythm and what that ultimately means for longevity. That was a lot of questions packed in one, but I just want to make sure you talk everything circadian rhythm, longevity, and what Epitalon does.
Yeah. Um, so for anyone not familiar with circadian rhythm at this point, it is basically your sleep-wake cycle. It's a 24-hour feedback loop that just kind of tells you when to go to bed, when to go to wake up. A lot of the shift workers, right? If you're working an overnight shift, your circadian rhythm is disrupted. People that disrupt their circadian rhythm, what do we start seeing? Metabolic disease. These are the people that desperately need GLP-1s because their circadian rhythm has been screwed up. If they're doing a night shift and they've been doing this for 20 years, they are gaining extra weight around the midsection. Their blood pressure might be off. They might be gaining signs of diabetes, insulin sensitivity gets changed. So trying to fight the circadian rhythm is not ideal. Um, allowing your body to fall asleep and to wake up at the times it would be. Like when the sun goes down and the sun comes up, we should be falling right with that. When our eyes get sunlight in there, it kind of wakes us up. And this is how the circadian rhythm works. It's set by the part of our brain in the hypothalamus that basically senses light. And when it comes in, it basically tells us, hey, it's time to wake up. Let's go. And basically, most of our body runs on the circadian rhythm. So a lot of the things in our body work on the circadian rhythm. We wake up, we start putting out transcription factors and turn on different things in our body to bring ourselves to be awake, to do the things we would normally during our day. And when you reverse this, again, this is where a lot of disease happens. So many patients will come to me and have sleep problems, and they have just a poor circadian rhythm. Their circadian clock is turned off. And there's different clocks, right? For women, there's a 28-day cycle, right? Our bodies do cycle in different ways. So we have the circadian rhythm that kind of keeps how we function through a 24-hour process going that we built out over all these years. So I will tell you, if you have circadian rhythm changes, you're going to have immune problems, you're going to have metabolic changes, cardiovascular disease. This is not good. We really need to get the circadian rhythm on point where we're sleeping the appropriate amount of time and the correct sleep, right? Deep sleep, REM sleep. We need these things to be part of it. If you're not wearing an Oura ring or tracking your sleep so you have an idea, I highly recommend that. I know this isn't part of the today's lecture, but I believe Ellie also has a Reebok ring now that they were using and can also help track these things. I am all about tracking anything you possibly can. Heart rate variability, what's your heart rate overnight? How long did you sleep? How well did you sleep? Now, I will tell you right now, none of these trackers are going to work as well as actually going to a sleep lab. But no one's got time for that. No one's going to sleep labs and staying there to find out how well their sleep is. When you wear some kind of wearable, it gives you an idea and you can track how your sleep is changing. When I have patients that aren't sleeping well, I want them just to track how is your sleep? What is changing sleep? How's it affecting? How's your deep sleep? What's your REM sleep? Now, this isn't exact data. Someone's coming to me and saying, my deep sleep was an hour and 22 minutes last night. Is that true? I don't know. Who knows? But when I see it changing, I'm wondering what's happening. So what you can do is you can use things like Epitalon to track, hey, how did my sleep change? Right? This is what we're trying to do. When we introduce something new, when we want to focus on sleep and circadian rhythm, we should see changes in how our sleep is. Did our HRV, which is heart rate variability, did that go up or down? Now, for anyone that doesn't know, heart rate variability, it's a very important thing to look at. Every time our heart beats, there's a little variability between each beat, right? It might be a little faster, a little bit slower. The higher your heart rate variability is, the more parasympathetic dominant you are, which means you're more in the rest relaxation, which is good. You want to be rested and relaxed, right? You want your cortisol to be down and be nice and chill. When your heart rate variability starts to trend downwards, you're starting to get sympathetic, fight or flight. When you're running a massive telehealth company, like some people in this little Zoom call right now, you might see heart rate variability start to go down when things don't go well and everyone's upset. And sometimes things are going really well and you feel really great and everything just kind of gets better and your heart rate variability goes up. So tracking these things is really important. Now, the nice thing is when you bring in something like Epitalon, you can watch what happened. Did my circadian rhythm go up or down, or go up or down? Well, that's going to be based on how well your sleep is, right? Did you sleep better? Did you have better deep sleep? Did you see improvements in your REM sleep? How are you feeling the next morning? I love Epitalon for sleep patients. It is my top level for sleep. We use, DSIP now, Delta Sleep Initiating Peptide in practice, quite a bit. It's my primary thing. The first thing for sleep for everyone out there is always going to be my tesamorelin or my sermorelin or my CGC 1295. Those are my primary drivers to improve sleep quality in patients. There's a lot more than sleep quality, but they're great for improving sleep. When you see a loss of growth hormone, sleep tends to go down. Also for women, you start to lose progesterone at 35. So giving progesterone back, especially in menopause, can help improve sleep. I also give men progesterone, very low dose, for sleep sometimes. But after I've exhausted the things I normally do, my tesamorelin, my CJC, sermorelin, I will move to Epitalon. Now, I've had patients start with Epitalon. They've said, I've tried everything in the world. Can we just do this? And if their sleep is awful, I will start with Epitalon right away because it does a really good job at improving sleep cycles. It can help that sleep wake, like we said, the circadian rhythm. And this is what we're trying to do with Epitalon. How do we reset this rhythm? Right? We want you to go to bed and wake up at a normal time and get adequate sleep. And if you can reset the circadian rhythm, this is one of the areas that we can really shine. I travel quite a bit right now. I speak internationally, and I typically like to travel with Epitalon. When you're changing time zones on a regular basis, going back and forth, 3 hours here, 4 hours this way, like, honey, you do. Utilizing something like Epitalon could be useful to help reset the circadian rhythm because when you're changing 3, 4 hours, right, it's not as much as going to Europe and having an 8 hour change, but you are going to have some change in circadian rhythm. When you go from LA to even come to Chicago and come visit and do a host event out here, honey, when that finally happens, um, out in my hometown, you have a 2 hour change. And if we can get you on, we can get someone on that's some kind of circadian rhythm being followed up with Epitalon, I do see improvement in jet lag. So for people that are having jet lag, they're traveling a lot, Epitalon is really great for that. It's really great for helping improve sleep overall. It's really great for helping improve your circadian rhythm. If you're a night shift worker, I really do like to use Epitalon more frequently than I would in a normal patient because that circadian rhythm is already so messed up. You can't force a change in the circadian rhythm. I can't just say, hey, you're a night shift worker. I'm gonna give you a baton. I'm gonna fix it because that's not gonna fix anything because you're still having this change in circadian rhythm. You're not getting that light you need. But using sun lamps, to mimic the sun when you're on a shift work, and things like Epitalon, you can actually help some of these patients feel better and actually improve their overall circadian rhythm. So the longevity side is when you have better sleep, everything gets better, right? Better sleep improves how your cortisol is managed, how your stress is managed, how your hormones are made, how your metabolism works. I mean, sleep is a master regulator at controlling how well your body functions. If anyone's out there tried not sleeping or not slept for days, I'm sure many of you have had these where you don't sleep for a few days or you wake up exhausted, right? How do you feel? Sleep is one of the biggest things out there, and it's one of the things I like to work on with patients. How can we improve sleep? Again, you can use growth hormone peptides, progesterone, but Epitalon is one of those big benefits, and it can help reset how the sleep is going. So a lot of my patients that aren't sleeping well, they'll come on Epitalon, they'll do a 10-day course, and they'll come back and say, my sleep got better. My sleep is still better, and it's holding after they finish. So it isn't just about using it while you're on it. It is about keeping the sleep better after even you come off. Said a good solid answer there.
Thank you. No, that's great. And if you could also touch on, because Epitalon has been studied for its relationship with melatonin. How is this different than taking melatonin supplements? How does this
Yes,
affect the
yes,
body's
yes,
natural
yes, yes.
production?
Okay. So, I am not a big fan of using melatonin supplements, just so you know. There is some, I talked to a doc a few years ago, Dr. Shelley Jordan, very, very smart man. He is big in the community for ultrasound to the brain. He's got some great papers out there, very smart. He's the one been studying this kind of pineal gland and melatonin for a while. He believes that using melatonin will actually cause more calcification to the pineal gland. This is what happens as we age, the pineal gland starts to calcify. And he has stated plenty of times that he thinks melatonin makes this pineal gland have a more calcification, which is again making poor sleep. If you can't produce melatonin, you get poor sleep. Melatonin is a hormone we naturally make. It's an antioxidant, just so everyone knows. So it's a great antioxidant. You can use it for that as well. But it really works at helping promote sleep. So Epitalon works at the pineal gland, the same place that we make this melatonin. That's why we talk about melatonin and Epitalon, the same kind of features. Um, when you're giving Epitalon, you're stimulating the pineal gland to synthesize and make more of the endogenous melatonin. This is just like we use the growth hormone peptides, right? We've talked about them to no end. And we talk about the reasons why we like growth hormone peptides versus taking growth hormone, right? When you can make your own, it's called endogenous, your own production of the hormone, it's always be better than giving the hormone, right? There are some times when I have a choice. You go through menopause, I can't do anything but give you the hormones. There's really no option out there. I can't make your ovaries start producing more estrogen and testosterone and progesterone as you age. But if I could, I would want to. So Epitalon restores how the pineal gland works and sends a signal to secrete more endogenous melatonin, which is going to beat out taking the exogenous melatonin, which again is more likely to cause calcification to the pineal gland. Um, when you just give a bolus dose of melatonin, you're just giving, hey, for example, when you buy melatonin and you don't know where you're buying it from, maybe you're buying Nature's Way melatonin, maybe you're buying Designs for Health melatonin. Not every company is going to have a standardized dose that is correct, right? This is also why we care about supplements and where we get supplements. Same as the reason we care about where we get our peptides from. Just because the bottle says this doesn't mean it's always that. And supplements are even less regulated than compounding pharmacies. There's almost no regulation. So if you're getting melatonin, they've done studies and they've shown people who get melatonin, that's one of the ones they actually look at quite often. It might say, 5 milligrams on that little bottle, and it might be 30 milligrams of melatonin. Now you just overdone how much you're getting. So I am also just nervous about, supplementation for melatonin in general. I don't think it's terrible to use, and I do have a lot of patients that have used melatonin before. I would prefer making more melatonin than just giving more. And then thing about Epitalon is it restores the natural production of how melatonin works throughout the day, throughout the night. This is why we like it because it can help reset the circadian rhythm, meaning it's working on melatonin to reset that sleep-wake cycle. So when you use Epitalon, it resets how the brain's actually producing melatonin rather than just giving melatonin at night and just forcing you to sleep, right? And dosages, right? When you give melatonin at night, maybe I'm taking 2.5 milligrams, maybe I'm taking 5, maybe I'm taking 10, maybe I'm taking 50. I've seen patients take massive doses of melatonin, and if I just give them Epitalon, the body naturally makes what they need to make. So I would rather give something that's going to make more melatonin than just give melatonin any day, all day. Melatonin does help improve sleep. It is what it's used for. Um, but this is going to work on the pineal gland in a different way and not lead to that same calcification that we might have by taking in just exogenous melatonin from, God knows where.
Okay, last question on the circadian rhythm. Cortisol is directly closely tied to the
Mhm.
circadian rhythm. So, can you talk to us about how Epitalon normalizes cortisol levels and what the benefits are throughout the day once you normalize cortisol production and the cortisol levels in the
Yeah.
body?
Okay, so cortisol is the stress hormone. If anyone's not understanding what cortisol
Oh,
is,
I
what's
know.
going on, it makes you stressed. You feel like garbage. All right. I had a patient today. I talked to him like, hey, by the way, what's my cortisol level? I'm like, oh, it's nice and low. Like, oh, okay, good. I just wanted to check. Everyone asks me what the cortisol level is. And I'm like, yeah, I mean, not this test isn't great, but realistically, saliva test is much better for cortisol rather than a spot test. I could have stuck you 3 times in your vein and miss 3 times. Your cortisol, you're gonna be up just kind of like on edge, like, just get this stupid needle out of me, right? And your cortisol can rise. Cortisol, it's quick. It goes up and down. So doing a more cortisol on someone is, kind of useful, but not as useful as a saliva test, which you can do. It's just a pain and more expensive. I don't run a lot of those. When necessary, they're done, but it's not often. So cortisol typically peaks in the morning. Should have some of the highest levels in the morning, and the day goes. You just want to kind of flatten that out. You want to go down, right? You want to be up. Cortisol help keeps you awake, gets you ready to go. It is a stress hormone, but some stress is good. It's not always bad. We call it the stress hormone because when it stays high, you kind of are on edge all day long. But it does go down. It works on raising blood pressure, it raises alertness. Like there's a lot of things cortisol is supposed to do, which is good for us. As they go throughout the day and starts to go down, it allows you to get into these deep sleep. When your cortisol goes down, you can sleep deeper. If your cortisol's up at night, a lot of people say, my cortisol's up at night. I can't sleep. I just can't sleep. They're taking ashwagandha. They're taking all these, botanicals to help them sleep, valerian root to help lower cortisol levels. This is like the buzzword everyone talks about. My cortisol is up. I'm getting that fat around my belly. It also leads to that fat around your belly. Cortisol's got a lot of things it does. The nice thing about Epitalon is it helps regulate this. So when you use Epitalon, what it's going to do, it's going to work on the HPA axis, which is the hypothalamic pituitary adrenal axis. What we're trying to do is help bring down this cortisol at night. So typically, Epitalon is meant to be dosed in the evening, and it's going to work at reducing your cortisol levels, helping deeper sleep, better sleep. You just get that relaxation in the evening. The problem with high cortisol is you can't fall asleep because you're on edge, right? It's an alertness hormone. Cortisol wakes you up. You need cortisol to go down to fall asleep. So by working on the HPA axis, which is what Epitalon does, you do help improve sleep and improve cortisol in the evening to allow it to decrease. It's one of a handful of peptides to do that. DSIP, delta sleep initiating peptide, also works on cortisol production in the evening. When you have sleep peptides and you're using those, those are things they usually work on, lowering cortisol to help promote better sleep.
I just want to ask some of the questions that I keep seeing in the chat. Number one, the protocol for this is two times a year for 10 straight days. Um, but how soon will you see and reap the benefits? And how often, like, how long does it take to wear away, I guess? When do you notice that your sleep goes back to its normal cycle? And maybe you could touch on that a little bit.
Of course. Um, that's the way we've been dosing it for longevity. Now, I can't say that I mean, I use it for sleep the same way. The 10-day protocol is the way I use that in practice, and it's being used right now. Some people do 20 days, which is not really how it's done. It's supposed to be a 10-day protocol. Some people do 10 days higher dose or 20 days lower dose. I always go with the 10-day higher dose just so people understand. I think that's a better dosing protocol. I'll have people say the first day or second day the sleep is better. I mean, I'll take it. My sleep is better the first day. I have better sleep that night. So I actually see my aura ring change when I'm using Epitalon. Patients say the same thing. Now, I have had patients have a paradoxical reaction. Just so you know, it can happen where your sleep gets worse from being on it, which is pretty strange, right? Again, not every peptide works for everyone. And I'll switch those patients to a morning dose of Epitalon, and actually it tends to work a little better in those people because though some people aren't looking for the sleep benefit, they're looking for that telomere lengthening, for that longevity side. So you're not going to see the longevity side right away. My mom, when she finished the protocol, was probably 9 days in. That's when she noticed her restless leg syndrome was gone. It wasn't like she
Mm.
noticed day one. She noticed way later, right? The woman that had some hair color come back. It wasn't that she noticed, in 10 days. That took like a month. And she goes, I don't know. She goes, that protocol, I don't know what happened, but like, this is the only thing I've changed. Epitalon, and my hair's, I see some color at my base. Same as the woman who had her cycle back. It was not in the first 10 days, it was probably about 20 days out. So it's not that you'll see some of these other benefits that Peloton might have. Again, it does a whole host of things. Imagine helping your cells live longer and be able to perform better. Brings inflammation down. That's the other thing this can do is bring down some inflammation in your body. You won't see that maybe right away. It might take a little bit longer to kick in, but the sleep improvements are typically seen that first couple of days. First 3 days, you see sleep improvements. Not everyone uses this for sleep. I do like it for the sleep benefits, for that circadian rhythm reset. I do tell people it does last for a few months. I've seen patients it's lasted on for 6 months. I've seen patients who said it lasted 2 weeks and then it was back to where it's at. It's really dependent on the patient and on the person. And in those patients that it actually worked on really well, and they come back in like a month and say, ah, I don't feel as good now. My sleep isn't as good. Can I run it again? I say, sure. There isn't a disadvantage for doing another cycle sooner. So if someone does notice some improvements, but they don't see the improvements holding, I will likely run it again. And if after the, if it's like, oh, this only lasts me a month each time, what else is going on? Why do we have cortisol issues? They're staying up. Is there some stress in your life? Do we add some meditation and some yoga? What else do we need to do to help improve you? Or what other things are leading to the sleep disturbance that Eptalon's not really covering? But I do find
Mm.
that 1 month is pretty short, but I will see people at 4 or 5 months who still have improvements overall.
Wonderful. And it's 10 milligrams. That's how much,
Correct.
that's the protocol. 10 days on, and then you cycle it two times a year. So 6 months later, you'll get back on a 10-day cycle. You mentioned inflammation, and obviously, in the longevity circle, inflammation is something that a lot of doctors, physicians, clinicians talk about. Chronic low grade inflammation begins to accelerate as we get older. Can you touch on what happens? Why does inflammation begin to accelerate as we get older? And how can Epitalon help and assist with low grade inflammation throughout the body?
Yeah. Key drivers of inflammation. We talked about this a little bit earlier. Senescent cells. The senescent cells, these zombie cells that sit around that keep firing off these random messages, those lead to inflammation, right? We see an increase in NF-kappa beta. NF-kappa beta is it's inflammatory, big transcription factor. It's a cytokine that just runs around, just keeps inflammation up. Mitochondria don't work as well. When mitochondria don't work as well, they're going to put off more reactive oxygen species damage. This is where we talk about oxidative, damage, oxidative issues. We talk about antioxidants, blueberries. The reason we talk about antioxidant therapies is because we get oxidative effects very often from mitochondria getting damaged as we get older. Mitochondria don't work as well. They spit off more oxidative damage. And then the last thing I talk about is gut dysbiosis. So when your gut doesn't work as well, you're having increased intestinal permeability, you're having increases of what's called LPS, of polysaccharides. You start to have issues with your gut. And all of this can help drive and lead to inflammation, right? Gut dysbiosis, what are we using? BPC 157. That's a great thing for that. Mitochondrial dysfunction, what do we use for that? Well, guess what? There's some MOTS-c out there, and SS31 you can use. NF-kappa beta, what do we like for that? All the GLP-1s. We love these. In fact, GLP-1s can even work on all these things we're talking about. They can actually help improve. The senescent cells, one of the reasons that's the last I'm talking about here is because this is where Epitalon can work on. I just discussed earlier how Epitalon can help improve these senescent cells. It's going to work at the top level, reducing things like senescent cell turnover because these cells don't have to die off as quick. So by slowing down the cell death, by the time the cells get to, divide long enough, there's no divisions left, they can turn into senescent cells. So if you can lengthen this time that these cells live, you can help or can start divide. You can reduce senescent cells. It can also reduce reactive oxygen species, and this is going to turn into more decrease in systemic inflammatory conditions or just systemic inflammation. So it's not like it's a directly work on NF-kappa beta like you'd see with a GLP-1, but it is going to work more upstream, helping things like, again, cell turnover and reactive oxygen species damage, which is the two of the things that can cause inflammation.
Yep, there's a phenomenal book, and I've talked about it over and over again. It's called The Telomere Effect. It's wonderful. And I think Joey has volunteered, Joey Udovich, she has volunteered to start a book club. So get with
There's a
Joey
book
if you
club
want
like
to.
Joey? Joey, where
Yes.
do I sign up? I want to be part of
Well,
it.
we had to recruit our teacher here to start the book club, but um, it's not just aging that affects the telomeres. I mean, life stresses and different factors
Yeah,
speed up the telomere shortening effects. So this is just such a wonderful, wonderful, wonderful peptide when it comes to that.
yeah.
Um, Now, for individuals who are on other peptide therapies for longevity purposes, can they pair this with other longevity products? I know what the answer is, but I just wanted to hear it from you. And then from here, we'll take some questions. So please post your questions and we'll get to them.
Yeah, did I not just mention how I've already put you on
I know.
GLP-1 right there? I've already put you on testosterone with this to help you sleep, and then I'm going to Epitalon. It's not that Epitalon can't be by itself. It definitely can. I've had patients call up and just order this, and this is all they want. They just want Epitalon, anything else. You don't want GLP-1? No, I just want Epitalon. Great, fine. Most people are stacking this, right? This is the kind of like your top layer, right? We get tertiary, we have peptides that we're like everyone GLP-1, everyone on a growth hormone peptide, everyone take these things, right? And then we add things, right? When patients are looking at their budget, hey, I can only spend this is my budget I can add. I can't take much more. What can I do? Right? And then we start saying, well, what else do you want to work on, right? Is sleep important to you? Do you want to work on telomere lengthening? Do you want to work on your aging, you're slowing your aging down? Well, trying Nefertalin, maybe this is the thing we add next. So it can be stacked on anything you're doing. I used to have patients stop everything else while doing Epitalon. I've since changed that. I now keep on everything else while on Epitalon. But I used to do it just by itself solo. I take 10 days, stop everything, which actually works out. In some patients, when they're doing that 3-month protocol for being on this is more for being on like a growth hormone peptide. And typically, when someone comes off the growth hormone peptide for a month, I'm like, okay, let's do Epitalon now. Let's do something else. Like you want to take the break, let's put you on this now. So if you're someone that takes a break on your growth hormone peptides, then you can maybe use Epitalon right when you finish and go, okay, let's do this, right afterwards. You don't have to. I'm not saying you have to do that. I do stack it right now in patients. Most of my patients are on Epitalon and multiple other peptides. But for those of you out there that say, hey, I have a month off now, what else can I do? That's when Epitalon might fit in that program for you.
Wonderful. Thank you. Okay, let's take some questions. I've seen this come up a couple times. Does Epitalon help to decalcify the pineal gland?
No, once you're calcified, that is it, ladies and gentlemen. It is not a reversal agent for that. You can't decalcify anything. That calcification is stuck, and it's like a fossil. So
No.
sorry.
Okay. If someone has a strong family history of Parkinson's and dementia, does lengthening telomeres potentially delay those disease processes and extend healthy years? Or could it simply make us live longer while still developing and therefore living longer with the disease?
Great question. After seeing my mom's reversal on restless leg syndrome, which is a dopamine disease process, which is Parkinson's and Alzheimer's, I do believe that. there isn't, again, the problem with Epitalon is the data is scant. It's small. There's rodent data, there's fruit fly data, there's not much human data, but
Well, in
based on the
Russia, there's some
yeah, no,
in
no, no,
Russia.
there's definitely Russia, but did they study restless leg syndrome and doping
No,
issues? No, they did not. That's what I'm saying. They
no.
don't have data on that. Now, based on how it works, yeah, I would think it possibly could improve that. The idea of it keeping the cells around longer, right? We're going to have this division, and when this division happens, again, I mentioned how senescent cells can lead to things like Alzheimer's. So if you can slow this process down, you can slow down the Alzheimer's, Parkinson's. But also, if that's the question you have, you should already be on a GLP-1 to stop that from happening in the first place. So this could add to that.
Okay,
And
oh, go
go
ahead.
ahead. No, it's all
No,
you.
no, I was going to go to the next question
That was
just
the
to
next.
make sure.
I was gonna ask you, can you do this more than twice a year with Ellie? I don't know. Someone else saw that. Someone asked that if you can do. I use it more than twice a year in practice. I don't know if I don't assume, know if you'll let that happen. What the doctor's group has, they've said, but we use it. We've used it more than twice a year. I've had patients use it 4 times a year. Again, not that you couldn't even probably do it more than that. I wouldn't run it continuously. In general, in patients, is not a good reason I wouldn't say that. I have had patients running low dosages of it. We're talking like 1 milligram to 2 milligrams long term. I don't think LAMD is going to allow that, but I don't know how often you guys or how often it's going to be allowed. People do, can they do it 4 times a year?
No, as of right now, the doctor's protocols are two
Do
times
it
a
twice a
year.
year. Okay.
Yeah, just 2 times. Um, but not to say that can't change. We could look into it for
Yeah.
sure. Um,
I saw the other one, adverse effects. I mentioned this earlier for adverse effects. Sometimes people get the paradoxical sleep where they don't sleep on it. They feel like just I can't wired. And that's when I move to a morning dose with patients that have had that happen and does improve that. These people, I'm not looking at improving their sleep. If they were using it for improving sleep, well, then that's a whole different story. But I'm using it again for longevity. That's a big reason I run Epitalon twice a year is that improvement in longevity, right? Like I said, the top 10% of people, how long they live, they get to live 10% longer. So if the human lifespan is, 80 years, you get to 80, that might add 8 more years of life to you. So again, the data on humans shows reduction of cardiovascular disease. We do see that in humans. We have seen that in the small studies that are done. They're not massive, but there was enough of a signal that maybe this does something to prevent heart disease from happening.
okay, aesthetics. Can you talk to us about other aesthetic benefits? You mentioned gray hair. How about skin, nails, anything else that we could notice as men and
Yeah.
women?
Yeah, let me tell you, if you can improve sleep, you're going to improve skin quality. So if you have sleep as an issue, and this is part of the problem, improving sleep is number one. You get aged really quickly when you don't sleep, like really quickly. And bringing inflammation down for sure. Same idea. Bring inflammation down, skin quality is better. This isn't a GHKCU, right? We're not going to take this stuff and say, "Oh my gosh, my skin is amazing." But remember, this is how those peptides work, right? Aging is a process of just this, right? This is all we're doing. What we're trying to do with peptide medicine, with all the things in longevity care that we talk about, is just how do we hold you here and slow that process down. So, can I say that you're going to reverse how your skin quality is? Again, some patients will probably say they've tried this. Yeah, it and help improve my skin. Placebo effect or not, I don't know. But if you think about what it does and how it helps senescent cells, potentially it could help improve that. So I'm not going to throw it off the table, but I will say it's not the thing I would do most. Number one, if someone came to me and said I want better skin, I wouldn't be like, "Oh, Epitalon, let's do it." I'd be like, GHKCU. Then maybe in the future we can maybe do something else to help you live longer, feel better. Maybe this will improve your cells as well.
That's wonderful. Okay, I'm not seeing any additional questions. If anyone has any, um, if I can be with my family 8 more years, I don't care if my skin is
Yeah,
wrinkly.
who
So,
cares?
in
Wrinkles don't
other words,
matter.
this peptide's insurance to add those extra years. Can you
Oh yeah,
address the question
yeah,
of
I saw that one.
Vanessa?
I saw that, honey.
Oh,
Yeah, for night sleep, for shift workers, you want to take it before bed, right? If you're a shift worker, you still want to take it before bed. You can. I've used it in my shift workers before, my firefighters, my nurses. Again, because you're working overnight shift, it is really difficult. So you want to use it on the same sleep wake cycle that you normally would have. So before you go to bed and when you wake up, you're just going to do the same thing because again, it's pushing out melatonin. And when you're trying to sleep, improving melatonin is actually very useful because again, we talked about melatonin helping get sleep going. So you can use it for shift workers. This is when I would actually use it more frequently in my shift workers. Unfortunately, like I said, maybe they'll be discussed. You guys can do a bigger, more protocols with this and more frequently. but I do use it as the time you go to bed. So whatever your time you're going to bed is, that's when I take my Epitalon right before I sleep. And then I go to bed and then I wake up and the same thing next day for 10 days. So I have seen shift workers improve how they feel. Again, you're working shift, so it's really, really, really hard to maintain that out of body alignment because it's not fixing your circadian rhythm when you are not getting that sunlight that you normally would in the beginning of the day.
Amazing. Dr. Pencek, thank you again. Any additional information you'd like to add? Anything you'd like to leave
I
us with?
am releasing a course, peptide course here. Like I think next
Yes.
week we're doing our friends and family right now, and I'll have a course set up. I know you'd asked me this a while ago, so finally finished. It's all done. It took me a little while to get done. I talked to my one of the guys I'm working with, so we'll have a course up and running, literally in a week, and I'll have a set up with some kind of subscription model, so I can have some monthly phone calls, do something similar to what we're doing here and sit and talk about a topic for a month and answer questions. So I have like a question or answer session twice a month to go through anything people have that are like, I want to know about this. All these questions I'm getting here, they'll all be there.
Oh,
So
that's
I should have
wonderful.
it up. It will be available to start next week. This week is my kind of 1 week of just my friends and family telling me how good or bad it is. And then next week we'll have it live, and hopefully we can show that to the Ellie community, and I can get a full course that goes over a lot of the peptides and all the stuff that Ellie has, some stuff you don't have yet, and hopefully we would see in the future. So
I know we've been counting down to your
good. That's
courses
good.
coming out.
I have been
So
too. Don't worry.
I'm excited and I know our community is thrilled to have it. So thank you.
Awesome.
As soon as you get it up, let me know and we'll get it out there to our
Awesome.
community. Thank
Thank you
you
so
all
much.
for joining us and thank you for coming on again to educate our community, Dr. Pencek. We appreciate you so much. We appreciate you as our Ellie community. This is
Yep.
all everything that we have is thanks to all of you. So thank you so much for tuning in and join us again next week as we
Can I just say one
continue.
more thing?
Yes.
I love this community, by the way. Just so everyone
Oh,
knows, I do this because I love being here. I love coming and showing for these events. You have built a wonderful community, honey. I want to say this again. Everyone here, you don't understand. I have messages in a group chat right now with 20 men messaging me about random stuff all the time. And your community does a good job because they you guys get these messages like I have all day long. And you do a really good job talking to your friends and family and people around you and explain to people. And I think this is what the community is about. You have built something really special. And as much as people hate on what Ellie has been, unfortunately, I think it's much better than Hims and Hers and Mochi and all these other garbage places because there's no one to talk to, right? And you have built something really special here, and
thank you.
everyone here, you are part of this community. You all, again, I wish Honey was giving money for this. She's not. I just love what she's built, and you guys actually talk to each other and can share this information in a much better way than your regular doctor calls up and just says, "Hey, take this peptide and your GLP-1, just take more." And you might have a better answer and say, hey, I know you need to take more, but also what's your protein like, right? You're calling people out and saying protein. What's your sleep like? What's your exercise like? And that's not being talked about by the doctors. And that's what everyone here is doing outside of that, which is what makes this so much better than every other telehealth platform that really exists. So just wanted to add
Jason,
that. Of
thank you for all that you do behind the
course.
scenes. I know you take care of this community offline.
Yeah.
I know people message
I
you
have
all the time.
a lot of people message
But
me all the time,
yeah,
honey. A lot of people.
I
So
know. No, I know how much you do for us. And thank you for the educational content that you put out. You've been
of
doing
course.
this for almost a decade, consistently. Every
Yeah,
single day you post a video. So we are
I
so
do.
proud of you. And thank you for being part of this with us. Thank
Course.
you for being
Well,
part
thank
of
you so
this
much for
journey.
providing this for all the
Yes.
women and everyone out there, the men too. So we appreciate you.
Oh, thank you. Have a wonderful night, everyone. I will see you same time, same place next week. Love you all. Thank you,
Thanks.
Jason. Take care. Good
Bye, honey.
night.